cases down. We just need to do those two things over the coming weeks so that as we get into summer, we'll be able to have a better situation.
Thank you. Operator, dernière question au téléphone. Last question over the phone.
Merci. La question suivante.
Thank you. The next question is from Elise Buzetti.
La parole est à vous.
Yes, good morning, Mr. Trudeau. I would like to come back to this issue of the proof of vaccination for a patio or to go to the movies or to go to a restaurant. Do you agree with the establishment of this type of proof? You said it could pose ethical issues. Can you give us more details on the problems that you foresee? Answer. Thank you, Hélène. Obviously, it's an important issue, but it's a delicate one as well. We want to encourage as many people as possible to get vaccinated because that is how that we will get through this pandemic. We saw it in other countries that a certain level, there's a plateau of vaccinations in the population that is still too low to really provide security. We need to reach over 75% of Canadians vaccinated with the first dose, and we need to continue administering second doses to have a one-dose summer. To do this, there are many people who are looking at the idea that with proof of vaccination we could do more things. Certainly for international trips, that will be very important. But for domestic usage, I know that some provinces are looking at this. There are always concerns about fairness. Does everyone have access to vaccination? Does everyone have the same ability to get vaccinated? First of all, vaccines are free. They're paid for by the federal government, so that removes some concerns of fairness. But we also see that some communities or some cultures are a bit more reticent to get vaccinated. We want to strike the right balance. We want to encourage everyone to get vaccinated as soon as possible and to have more freedom after they get vaccinated. That could be part of it. But we need to ensure that we're not being unfair to people who are already marginalized or vulnerable, or perhaps a bit more reticent. So the discussions are ongoing between the different levels of government, and we are looking at how we can do this right and ensure that it's a positive thing to encourage people to get vaccinated without harming or disadvantaging some groups of people. That is the concern that we all have. Follow-up. I heard you on that, but for example, this idea of sharing medical information or one's identity to merchants and this issue of privacy or Big Brother, what do you think about that? Answer. We know that we can get through this pandemic, but we need to do so through vaccination. And the vast majority of Canadians will need to get vaccinated. And it's not just a question of protecting ourselves. We need to reach the threshold of that will protect all of society and all of the community. I understand that we might not want to share private information about someone's health, but this proof of vaccination, this information that someone had a vaccine or not, I think that because it has such a huge implication for public health, if we reach this 75%, 80% goal, I think that it's information that we should share, be able to share, but while being careful to not share the medical situation of some people who can't get vaccinated because they're compromised or something else. We need to create a way where we're not infringing on privacy, but vaccination is something that's important for everyone, and I think that we should be able to share that information. But as I said, again, the conversations are ongoing, and we are being experts who weigh in on both sides of the argument.
To encourage Canadians to get vaccinated. We know we're not going to get through this pandemic until enough people get vaccinated. 75%, 80%, even more get first dose and second dose. So anything we can do to encourage people to get vaccinated is going to be important. And that's where the idea of proof of vaccination for different services or better access is something to look at, particularly because vaccines are free. They're paid for by the federal government. There is going to be enough vaccines for everyone in the population. We just have to reflect upon certain communities or vulnerable Canadians who might still have more difficulty accessing vaccines or might have resistance to vaccinations because of cultural or other realities that we have to be thoughtful about as we move forward. And then when it comes to the privacy aspects of proof of vaccinations aren't just about protecting the individual. They're about protecting all of society, and particularly vulnerable individuals who, for medical reasons, can't actually get vaccinated. So it matters to know that Canadians are getting vaccinated. And I think we should be able to walk the path between respecting someone's privacy, but also understanding that whether or not someone's vaccinated is something that we should be able to make use of to both encourage people to get vaccinated and keep all Canadians safe.
Thank you. We'll now take questions in the room. Tonda?
Good morning, Prime Minister. Tonda McCharles with the Toronto Star. Can I go back to what your remarks about one-dose summer, two-dose fall? We've had national guidance on masking. We've had national guidance on immunization. And I'd like to understand what you think, or if you even think there's a need for a national reopening plan that uses some of these markers. I mean, are you contemplating giving guidance to the provinces on case counts per 100 or whatever, like the case may be? I don't hear that kind of specificity. And already Saskatchewan is kind of ditching the 75% first dose. They're saying 70 is good enough.
I think it's really important that Canadians understand that we could have a much better summer if two things happen. If the case counts get under control across the country, if we're able to crush COVID and keep those case counts really low with adequate measures around screening and contact tracing and isolating whenever there are pop-ups or outbreaks that will happen from time to time. We need to get cases down, and we've seen from waves in the past the problems that happens if restrictions are opened too early. It just leads to a greater next wave. So the first thing we need to do to make sure we're getting into a one-dose summer where people can be a little freer and have a little bit more normal summer with friends around the barbecue is case numbers need to be down right across the country. And local public health officials will make determinations about what under control and what case counts are. It could vary a little bit, but the cases need to be down. Secondly, Canadians have to get that one dose. Canadians have to get vaccinated to over 75%. And if we have those two things, if case numbers are down and if over 75% of people get vaccinated, we can have a summer that'll be much better for everyone. And that's sort of on all of us. Different orders of government. The federal government needs to make sure, as we are, that we have enough vaccines for everyone to get one dose before the end of June, which we will, and that second dose continues to increase in terms of being delivered. That provinces keep the restrictions necessary in place until they get the new cases totally under control and are able to handle and respond to any little outbreaks that we know will happen. And third, Canadians need to get vaccinated. We have more and more vaccines coming in. We're going to be able to have enough doses so that we can have that one-dose summer, which will set us up for a two-dose fall, which will be much, much better. But everyone needs to do their part. Get the case numbers down and keep them down and get vaccinated. That's how we get through this.
Next question. Hi, Prime Minister. Stephanie Taylor with the Canadian Press. Going back to AstraZeneca for a second, given that experts have said that mRNA vaccines are the preferred ones and there are ongoing safety concerns with the AstraZeneca shot, will Canada stop negotiating with the United States to get their doses of AstraZeneca and instead ask for, say, Moderna?
We're going to continue to talk with all our partners about ensuring that we're able to get Canadians through this as quickly as possible and as safely as possible. We will continue to work with the United States, with other countries around the world to ensure that we get enough doses to get Canadians vaccinated with one dose before the summer and that second dose through the summer so that we can have a much better fall. But on the safety concerns, I'm happy to turn to Dr. Tam to speak to that.
Thank you for the question. And I think that, as the Prime Minister said, it's really important to increase vaccine uptake because it's going to play a really important role in helping us control the pandemic and reduce the risk of resurgence. I think he provided a really important point in terms of getting the cases down at very low levels so that we can provinces can actually test, trace, isolate, and put out these more targeted approaches so they're not going back into the fall with the more restrictive measures. That's the sort of vision going forwards. And in terms of, AstraZeneca, I think what I would say is, first of all, remind everyone that anyone who got the AstraZeneca vaccine did the right thing in protecting yourself and those you love and those around you. Of course, we have to take any reports of serious side effects, however rare, very carefully. So that's what is being done, and so that Canadians can have the appropriate information to make informed choices, and the provinces can design their programs. But what I would say is that, right now, the National Advisory Committee on Immunizations recommending 2 doses using the same vaccine. So we will make sure that those who got the AstraZeneca vaccine, the first dose, can be provided with a second dose. At the same time, we're following the evolving science, including the studies from the United Kingdom, to provide the most up-to-date advice on whether a mixed dose schedule is the appropriate way to go. And that would offer a choice, essentially, for those who have received AstraZeneca for the first dose. And so I think the bottom line is we take any reports of serious adverse events very seriously, and that is being taken into account as we design our programs going forward.
Next question.
Bonjour, Monsieur Trudeau. Louis Blouin, Radio-Canada.
Good afternoon, Mr. Trudeau. I'd like to come back to the line 5. If the mediation fails between Enbridge and Michigan, will Canada evoke the 1967 treaty between Canada and the United States, which limits bilateral transactions between natural resources? We recognize how we are interconnected with the United States in terms of energy. And that is why we are working very closely with the Americans on this issue. I know that the Minister of National Resources, Minister Regan, will be making an announcement very soon to discuss about our position on the matter and our concerns about the situation. We will always do what is necessary to protect Canadians' interests, to defend the energy security of Canadians. We will have more to say in a few hours.
I can assure you that we are watching very, very carefully the situation with Line 5, as we have for many, many months. We've continued to engage on it, and Minister of Natural Resources, Seamus O'Regan, will be out shortly with an announcement on further engagement by the federal government to ensure that we're defending Canadian interests and Canadian security.
Glenn McGregor, CTV News. Prime Minister, you've repeatedly told Canadians not to travel abroad. Earlier this month, your foreign minister was in the UK. He's headed back to Iceland later this month, even before his 14-day quarantine period is up. You've talked about the possibility you're going to go to the UK for the G7. What do you say to Canadians who have put off travel, maybe to go to funerals or to see family around the world, when they see that's a mixed message, that people in cabinet are traveling, but they're not allowed to?
We continue to highlight the need for essential travel. There are thousands of trucks with food and essential goods across the U.S. border every day. We continue to see essential travel happening. The question always remains, what is essential travel and are the rules going to be followed? We had to make sure that we kept Canadians safe when we shut down the borders to non-essential travel. For non-Canadians over a year ago now. And Canadians and people around the world have responded. We have seen a drop in over 95% in travel volumes over this past year, and that has kept Canadians safe. But there are moments where essential travel is necessary, and those decisions will be made. But at the same time, all proper safety protocols will be followed. All quarantines and testings will be abided by because nobody is exempt from keeping Canadians safe.
For you and Minister LeBlanc, possibly, the Justice Minister in Alberta made some comments last few days about how the provincial NDP and the media and the federal Liberals wanted to see Alberta's provincial health system collapse during the pandemic. Wondering what your response is to that and whether it colors your relationship with Alberta as you try and work through the pandemic.
I think it's a shame to see people pointing fingers and laying blame and suggesting that anyone in Canada wants anything else than to get through this pandemic as safely as possible everywhere. Last week, I reached out directly to the Premier of Alberta, to the mayors of Calgary and Edmonton, to continue to offer all the help that the federal government could possibly offer to help Albertans and indeed all Canadians get through this. Every step of the way, the federal government has been there to support Canadians, with 8 out of every $10 in pandemic support coming from the federal government. We will continue to work with Canadians. We will continue to work with all governments across this country to make sure we're getting through this. That's what Canadians want to see. That's what the federal government wants to see. That's what opposition parties want to see. And that certainly is what the media is focused on as well. I think playing politics at this point is just not what Canadians want to see. Je pense que c'est très clair qu'il y a personne.
I think that it's very clear that no one in this country wants anything other than to get through this pandemic with as little tragedy as possible across the country. As a government, we have always been there for all the provinces and territories. Last week, I spoke with the Premier of Alberta. I spoke with the mayors of Edmonton and Calgary to repeat for the umpteenth time that the federal government will always be there to help with whatever is needed. We helped Albertans, we helped workers. 8 out of $10 of pandemic money has come from the federal government. And we will continue to be there for Canadians. I think it's unfortunate to see people trying to play partisan politics because no one wants anything other than to get through this pandemic safely, whether it's governments, the opposition parties, or the media. We will all continue to work together because that is what Canadians need and that's what they expect of us.
One last question. Salima Shif, GCBC. I want to ask you about what's happening in the Middle East. So Canada's policy on Israel and Palestine is predicated on the existence of the Oslo peace process. A lot of experts say that process has been dead for years and doesn't reflect the reality on the ground. The reality on the ground is renewed tensions. So with that in mind, what do you say to what we are seeing in Jerusalem as well as in Gaza, the exchange of rockets and airstrikes in which 9 children are among the casualties?
The violence and deaths we've seen in Israel right now and in the region are terrible. There needs to be de-escalation immediately. We need to see a cessation of violence and attacks. The rocket attacks from Hamas are absolutely unacceptable. But we're also gravely concerned about the settlements and the evictions of Palestinians. We need to see a return to conversations and dialogue and de-escalation, an end to the violence, including the violence at the Al-Aqsa Mosque, which are just heart-wrenching. We need to see a path towards a two-state solution through negotiated conversations. Any unilateral, unhelpful actions on either sides are not contributing to the kind of future we all need to see.
Merci, Monsieur le Premier ministre. C'est tout le temps que vous avez avec nous.
Thank you, Mr. Prime Minister. That is the end of your availability. We will now continue the press conference on the telephone. Operator.
The Prime Minister on this Tuesday morning with an update on